Hi everyone, it's Elaine here and welcome back to the Homespa Beauty Podcast. Now I've had a request and it's a huge topic. You could talk about it for weeks on end, and it's acne prone skin and also back acne. Now we obviously can't speak in a podcast and then give you solutions to it because everyone's acne is individual, and sometimes it's really difficult to get clarity on what acne is because in some vicinities they would consider acne to be any more than 6 spots on your face. So some people might not even think that they've got what could be classed as acne, but if there's more than 6 spots visible, then in some scenarios that's actually considered a form of acne. But you get so many different types, and today is not about going down the medical route. It's not about helping you to diagnose acne. What this really is about is just giving you some suggestions, some easy ways to start tackling it if you either think you've got it, know you've got it, and if it's mild and not infected. Now, if you've got infected acne, then if you haven't already been to the doctor, you must go, because you don't want infection to worsen, you don't want it to spread, and you don't want to be left with skin that is sore and possibly scarred. You could avoid that. So if you haven't already, go to your doctor, go to your dermatologist and get some advice. They will provide you with medication. If you want to, in addition to that, some people like to actually investigate herbal medicines. But again, be aware that if the doctor has put you on medication, these can interact. So while it's still very useful to go down that road, it's also worthwhile remembering that you should never just decide independently to take a herbal medicine because it could affect what you're already on. But that's not to say that you can't do your research. You can't speak to herbal medicine specialists. So many different ways that you can treat acne. So let's have a chat just about some basic ideas that you might not have thought about, might not have covered. I'm going to talk to you about some ideas, very simple ways to get started with treating your acne, and why it's a good idea not to overstimulate by overcleaning, which is probably the first thing that so many people do. They just want to scrub and scrub and scrub to make it go away, but it actually makes it worse. So we'll talk about that soon too. But one of the first things to think about with acne-prone skin and when it's on the back is, are you accidentally making it worse with the environment that you're in and the things that you're using in your day-to-day life that you haven't even considered? So the first things that I would ask someone to think about is, especially with the back, clothing. Are you wearing clothing that is irritating your skin? Are the fabrics not helping? So you could have fabrics that irritate the skin, sweat the skin can't breathe, the skin just becomes extremely angry and irritated and the breakouts become worse. So think about your clothing. You don't want to have anything like nylons and fabrics that just itch and scratch and just don't allow the skin that breathing space. So think about having loose, comfortable clothing in fabrics that work with your skin and not against it. Think about your hair. Now, in multiple ways, if you've got a fringe or if your hair falls onto your face, sometimes you don't realise that your hair, because you've got natural oils in your hair, that can actually cause irritations and it can cause breakouts and it can irritate acne. So if you've got a fringe and you've got just a naturally oilier hair, then lift up your fringe and actually see if the breakouts, if the acne, if the spots there are worse, and it could be because of the fringe. But that's a catch-22, because if you've got a breakout there, you might want the fringe to hide it, but maybe you need to make sure that the hair is clean and not oily. But another issue with hair is, are you using products that are irritating your skin? So if you're using shampoos, hair products, hairsprays, mousses, waxes, serums, if your hair is touching your face and it's not helping your breakouts, then you might have to have a think about what's on your hair. And remember, if your hair's long and it's on your back too, that could not necessarily be the reason for it, but definitely be adding to it. So think about your hair. Now, think about day to day the items that are touching your face. Do you always have your phone to your face? Do you use a phone in work? Do you use any equipment in work where you're touching your face? Do you work in an environment where your hands are contaminated and then you're touching your face? Even just day to day, are you a face holder? Because what you might be doing is actually not having clean hands and touching your face. Or if you're playing with spots and you don't even realise you're doing it, you could be transferring bacteria and potentially infection around. You don't even know you're doing it. Say, for instance, someone was working in a kitchen. There can be a lot of oils. Think about these are the cliches. If someone's working in a hot kitchen and there is a lot of steam in the air, and the steam is obviously carrying oils, and if there was, say, something like in a chip shop, a deep fat fryer, then there's a lot of oil present, and then it can be in the air and you can start to feel it. People say they can feel it on their face and in their hair, and then you might be touching your face. That's your working environment. So think about whether your working environment could be adding to it, and then you can use products before and after work to compensate for that. Think about, say someone was a mechanic and they had oil and grease and dirt and products on their hands, and then they were touching their face. That's obviously going to be cross-contamination. That's not going to help if you've got acne. That's probably going to cause some irritations in the skin. So this is about thinking what your job is, what's possibly on your hands, or what are you holding to your face, such as telephones. Are you cleaning the phones? Are you cleaning your mobile? Are you using a wipe on it to get, the antibacterial wipe just to make sure it's kept clean? If you've got acne, these are things to think about. Also, things like pillowcases when you're sleeping at night. If you've got irritated acne, if you've got breakouts, if there are some papules and pustules, so spots are actually leaking. I know it's not pleasant to talk about, but we understand that it does happen. If you're not changing your pillowcase, then every night when you go back to bed, there will be bacteria on the pillowcase. So you won't be helping yourself. You won't be allowing for all the products that you're using. If you're using them correctly, targeted products, you'll be making life harder for yourself because they're not getting a chance to do their job because your pillowcase isn't as clean as it could be. So think about that. And if you need to, you can change it every couple of days. Even if you needed to change it nightly, if you were really going through an infection at the moment, then just change it nightly, or turn it over 2 nights running and then change it. I was saying with pillowcases as well, not only could there be bacteria on the pillowcase, but you could be irritating your skin with the soap powder that you use, with the fabric softener. If there's allergies there, if it's too perfumed, then that could be making your acne worse. So think about the products that you're using. Again, if it's on the back and you've picked the clothing that you know will let your skin breathe, you're not using any irritating fabrics, but your soap powder or your fabric softener are part of the problem, and the ingredients are something there that's irritating your skin, or the perfume's irritating it, think about that too. So you really are starting at square one and you're working just bit by bit by bit, trying to figure out that you're doing everything that you can. Now remember, with acne, there are so many reasons why you can develop breakouts. Don't blame yourself. Now, it's so easy to be embarrassed, even when you've got one spot and it's in a really awkward place and you feel like everybody can see it. And sometimes you've got that lovely friend or family member that wants to make a joke of it. I mean, we've all been in that situation where it's either us or someone else, and it's the spot on the end of their nose or the spot in the middle of their forehead. And you'll always get that person that thinks it's hilarious to point it out. I'd always say, just don't. That person knows fine well it's there. They don't need you to tell them. So don't be embarrassed. Don't become obsessed with thinking everyone's looking at you. Almost everyone has experienced this or a form of skin condition at some point, even if it's like a swollen eye or a swollen lip, or someone's had a cold sore. Everyone has experienced the time when there's something visible on their face which they feel is just the worst thing in the world, and they don't want to leave the house. And when it's acne, you tend to feel as if it's the focal point of everything, and it can stop you wanting to do things. But you've got to remember that there are always avenues to explore with the treatment. And they're always discovering new ways as well how to tackle it. And it used to be that some of the older treatments were quite severe. And if anyone, you probably still get them now, but if anyone remembers when they hit their teens, some of the products that they probably would have tried that literally burned the skin off your face, or you'd try creams, you'd go to the chemist and try creams and they did nothing. So you had that horrible scenario where your skin was either raw and not healing, or you're putting on probably too much cream, because in your mindset, the more cream you put on, the quicker it's going to work and the quicker you're going to get a result. Try and relax and realise that this will be navigated through, and you can definitely help yourself, and you can go to the doctor and you can get advice from therapists. But it's really not going to help you if you get wound up about it, because the cortisol in your system just makes everything worse and can make the breakout worse. So try and stay relaxed about it, and don't let it really stress you out and just wind you up, because that's not going to help. So reasons to consider if you really haven't thought about it, and this is back and face. So we've covered some of these already. Okay, first one's definitely hormones. So think about your age. You know that there's different ages where you definitely get bursts of crazy hormonal activity. So think about your age, whether you're teens or 20s, or being honest with you, there used to be this cliched thinking that you got your spots in your teens, and then from 20s onwards, it was something in the past. And then in the last 20, 30 years, we have definitely changed. Now, obviously, there's always been people that have had problems at every age. But you must admit, if you sit and think at the moment, how many people say to you, you know, I maybe had a few spots in my teens, but then I hit my 30s and my skin went crazy. Or sometimes people say they never had a spot at all, and then they hit their 40s and their skin went mad. So it's probably got a lot to do with the lifestyle that we live now. It's much faster paced. We probably do have a lot more of a lifestyle variance to what we did maybe 30, 40 years ago. I mean, there's a lot to be said that they look into packagings now, and they say that they don't know if the packagings allow for chemicals to get into the food, and they don't know if we're eating and drinking different chemicals through packagings, and that might be affecting our skin. And then there's theories that the drinking water's got hormones in it because of the tablets and the pills that people obviously consume. And then when they pee them out and it goes back into the system, and even though the water's being cleaned, they say that when we're drinking our water, there are still hormones in it. I don't know if it's true, but if you do think about it, sometimes when you sit and think and you read these stories, you can understand why there could be some truth to it. So sometimes when you sit and you think about it, it might not actually be anything specifically uniquely about us. It could be a lot of external factors, but hormones and the cycle of hormones definitely plays a huge part in acne. So again, this is where I always say, start keeping notes, so that if you need to go to the doctor, you've got some notes. You don't just go in and present yourself and say, hi, I've got acne, what can you do? You can actually present the doctor with some background, and that will make it a lot easier for them to try and help you figure out what's causing it, why it's there, and the best way to treat. But again, cycles are a big one, especially for the females. Your monthly cycle, you can get spots. Some people know exactly when they're going to get their spot, and even exactly where they're going to get their spot. So definitely have a think about that. As I was saying, lifestyle. If you've got a very active lifestyle, if you exercise a lot, then that can cause breakouts on the back and the face. If you are sweaty, and again, you're not getting a chance to have a shower or a bath after you've exercised, or if you're at work and it's non-stop and you're really hot and sweaty, or you're active and you're stressed, all these different things can add to it. Even if you work in a hot environment, if you are using irritants, as we said before, it could be products that are irritating, it could be clothing. As we said, if you're touching the skin a lot, even the different times of year, sometimes in the winter, You can sweat because of the heating, and sometimes in the summer you can sweat because of the temperature, but these can all make acne worse, especially on the back. You could be irritating your skin with your facial care and your body care, and you don't even realise you're doing it. Your products could be too strong, they could be too oily or too rich for you, they could be drying your skin out, which could trigger the overproduction of sebum and oils within your skin. You might not be exfoliating your skin enough, and the build-up of dead cells might be causing blockages and clogging, which might be giving you breakouts. But again, just because you're not exfoliating doesn't mean that you have to start using scrubs, because scrubs can irritate an acne skin too. So it's about the style of exfoliating product that you go for. There are so many things to consider. So take a moment to actually write down the products you use, the lifestyle, how you're feeling about yourself, what clothing you tend to wear. Even take a look at your labels. Are there a lot of synthetic materials? Do you have a lot of breathable fibres? All these things are definitely worth looking at. Skincare ingredients, they can really irritate. So look at your product list on your favourite ingredients. You really, when you've got highly irritated skin, when you've got acne, you want to be going for key products that you know are going to help the skin. But in an ideal world, the less ingredients as possible, because the more ingredients, the more chance for irritation. Again, if you're using things like facial washes, be aware of what the foaming agent is, because for some people, sodium lauryl sulfate, SLS, can actually irritate acne, and it's in so many products. You might find that you didn't realise that your product had SLS in it, and that's not helping at all. So you might want to go, if you want to use a facial wash, go for one that is still foaming but SLS free. And there are a lot of choices now. You might not be allergic to it, but it's a good place to start. You definitely don't want to overstimulate the skin. So as I was saying earlier, sometimes when you've got a breakout or spots, there's this myth that your skin's dirty. It's the opposite. It's probably too clean because you're cleaning it all the time. You don't want it to be oily. You don't want to have any shine. So you might be cleaning and cleaning and cleaning, and then your skin doesn't understand what's going on, and it might overcompensate. So again, you've got to make sure that you take advice and you get the balance of products correct for you, and you apply them at the correct times, and you don't use too much or too little. Think again about makeup. You don't want to mask what's there, but at the same time, you're well within your rights to want to hide it, and you can absolutely use makeup to hide any breakouts. Of course you can, but you don't want to layer upon layer upon layer with the wrong makeup products that are too heavy and too thick and too oily and not right for you. You definitely want to go for just thin coatings of concealing products and powdering them in place very professionally, very carefully. And someone like Lisa Eldridge has got a brilliant video on how to cover acne prone skin. And remember, male or female, you can still cover a breakout. It doesn't have to be obvious that you're wearing makeup. So don't think that that's just for the females. Anyone can choose to put a little bit of coverage on, and believe me, when it's done right, nobody will see it. Now, you can use so many products with so many targeted ingredients. What I would say is we won't focus on those too much here. I would suggest something, if you can, again, as long as it's not infected acne, incorporating acids into your routine can really help, because they can really have an effect on making sure that the dead skin cells don't start to build up, that you never get to the situation where you start to get clogging, and the clogging causes blackheads, comedones, papules, pustules. So that's your red lumpy spots, or your spots with a head that have got some pus in them. Acids can definitely help with that. They can also help to soothe irritation, to soothe redness. But you've got so many different types of acids, and what you don't want to do is use the wrong one, or use too strong an acid. You don't want to mix them when you don't know what you're doing, because then you could actually do the opposite and cause irritation. You don't want to cause sensitivity. You also don't want to use them when you're going out in the sun and cause sun sensitivity. That's not going to help anyone. But you've got things such as glycolics, lactic acid, salicylic acid, the list goes on and on. So in a situation like this, I would recommend that you go to someone like Caroline Hirons, and then she has got lots of individualised videos that take you through very simply, in depth, on picking your brand, picking your strength, and what you can expect from that product. And there will be acids for everyone, and you can start off on a low percentage and build up. You can pick a brand that's not too potent, or if you know what you're doing, you can go into a brand at a level where you know exactly what the results are going to be. There's definitely something for everyone. So I would say, if you have got your acne under control and you're targeting it and you know exactly what you want to do, Caroline would be a great person to go and visit her library of videos. And if you want to keep it really simple and you don't want to go down what you would consider a complicated routine, you want to keep it just to basics, you're not looking for anything that you would consider fancy, then you can't really go wrong with gentle products and tea tree products. Now, tea tree products are classics in helping to reduce inflammation. They are antibacterial, and normally when they are designed for spot-prone skin, then you can be assured that the blend of tea tree within them will be potent enough to start getting results. But what you've got to do though is look for the brand that you're picking and be realistic with yourself. If you go for a tea tree product and it's £2 out of a chemist, then the chances are that you probably aren't going to get the level of tea tree, the essential oil, the quality of essential oil that realistically will be having an effect. So I'm not saying that you have to spend a fortune, but just bear in mind that pure essential tea tree oil is something that has a quality to it. You can smell it. It smells really fresh, and it's hard to say. It's not eucalyptusy, but it smells as fresh as that. Definitely does. But if something's too inexpensive, then I would look at the back, especially if it was something like a facial wash, and I would check that it didn't have SLS in it, because you might actually do yourself no favours if the tea tree's in it to help fight the bacteria, but then the SLS is going to irritate and break out your skin. And remember that if you do have any isolated spots that you want to treat, then you can buy some tea tree essential oil, and you can use a cotton bud and just very gently dab it neat onto those areas. Tea tree is one of the few essential oils that you can put neat onto the skin without irritating, but if you're really unsure, you can still blend it into some oil too. But I think the main thing with acne prone skin is taking advice on how to treat it and not just picking random products off the shelf and hoping for the best. Actually think about what it is you're trying to do. But more than anything, you do have to look at the external factors. With acne, such a huge part of it can be external factors. You can do something about those external factors. The internal factors, that's for your dermatologist and your doctor to help you with. And then so long as you can understand that it's something that you're working towards seeing improvements in, and you're not constantly beating yourself up that every day, oh, it's not getting better, it's still red, that spot's still there, oh no, there's another spot. Try not to go down that road, because it can really start to get you down and you can get quite upset and depressed about it. And that really, really doesn't help you. But overall, bear in mind that acne can always be treated, and when you get onto the right path and you get the right advice and you adapt those little bits in your lifestyle, you can start to see results really quickly. As always, I hope that's been useful. If you'd like to chat with me, if you'd like to ask me for a request or just watch some of the YouTube videos, then there's lots of ways to get in touch. And as always, have a lovely day, and I'll see you again soon.